Bonnie and Deja Owens used to feel alone. Deja's mother passed away when she was 2. Bonnie stepped in to care for her granddaughter. They had very little money, no support, and Deja needed medical care.
They have always been there by our side, and I think they have just taken us in as a family, really.
The Owenses don't feel alone anymore. They say the Rocky Mountain Youth Clinics has been their extended family. It is a medical home, a place they have been able to trust.
It's meant a lot to me because of how good they treat people, and they give you answers right away, not just you sit there and wait for stuff. And then they're really good with everything and everyone.
Seeing a great need, Dr. Larry Wolk started the Rocky Mountain Youth Clinics back in 1996 to help families like Bonnie and Deja.
The whole vision for the Rocky Mountain Youth Clinics is to provide care to every child who needs care, regardless of their family's ability to pay for that care, regardless of the circumstances of that child.
I think one of the things that's a little more unique in our population is that because we have some underinsured or uninsured patients, they'll come in sometimes with more urgent things that maybe they should have gone to the emergency room with, but they didn't want to pay for it, or they couldn't afford to go.
An estimated 180,000 children in Colorado do not have medical insurance. Thousands more are underinsured. The Rocky Mountain Youth Clinics is committed to helping those kids by providing high-quality services that treat the whole child. Their mobile health programs go to the patients and provide medical and dental services for kids throughout the Denver area. Over 2,500 Colorado children receive health care services every year through these mobile units.
I wanted to have the ability to go to the patients rather than make them come to us in order to receive their health care services. So the mobile clinics were an interesting way for us to kind of get out to schools, get out to more rural communities, get out to different events where we can use that then as an opportunity to provide care for kids.
For kids that are struggling with nutrition or are not getting enough to eat, RMYC's Thrive Clinic provides food and nutritional services through their food pantry. And in 2011, the Rocky Mountain Youth Clinics handed out 11,000 new books through their Reach Out and Read program. 13 programs in all, from their Get Fit program to their asthma clinic, all of them focused on treating every aspect of a child's health.
And it's not just care that we provide with a stethoscope or by looking into a child's ear, but it's everything related to a child's health. It's nutrition by providing food. It's transportation so they can get to and from us, or us providing care to them. It's providing culturally competent services so families feel like this is a part of their home. We call it their medical home, and we center that medical home around the patient.
That medical home is not a physical place, but rather an approach to providing comprehensive primary care to a population that desperately needs it. The need is great in our communities, and it continues to grow.
Generally, it seems like there's been a growing and sustainable need that regardless of the economy, there's always a part of our society that has difficulty accessing health care for their kids.
35,000 kids are healthier and happier every year because of the Rocky Mountain Youth Clinics. Many would not receive the critical treatment and care that they need without the help and support of the caring doctors and staff.
I think we really believe that if the family isn't somehow doing well, or at least, moving in that direction, that the patient can't be successful or healthy on their own. You can't have a healthy child with an unhealthy family situation. I think for me, it's just that these kids shouldn't have to suffer because of whatever financial or social situation their parents are in.
Unconditional caring. That is what Bonnie and Deja have received. It is what has made them feel not just cared for physically, but cared about as part of a family.
I don't know where I would go because I haven't found another place like this. If you want anybody to care about you, this is a place that they do care about all types of people.
If you are interested in supporting or learning more about the Rocky Mountain Youth Clinics, please visit us at our website or stop by one of our 39 locations. The Rocky Mountain Youth Clinics, improving the health of our children since 1996.